Okay, good morning, everybody. Dr. Ray here, Vet Triage, October 1st, 9:14 a.m. Pacific time. And we're going to go over a medical journal, boom, medical article in this medical journal, JAVMA, December 15, 2017. This is called Systemic Manifestations of Cuterebra Infection in Dogs and Cats, 42 cases from 2000 to 2014. Before we get started, in case anybody who's watching this does not know about Cuterebra, it's very, very cool. It's larvae. Those are two different life stages of the larva, and they most commonly bury under the skin of dogs and cats and rabbits, and you end up seeing this, see that little hole in that kitten's shoulder there, right? Let's see, right there. See that? And that hole is the air hole where the parasite breathes out of. So it's pretty wild. So just to give you some perspective on what we're talking about today, this is a study out of Michigan State University, a specialty center in Ontario, and a specialty center in Washington State, as well as one in Pennsylvania. They looked at 22 cats and 20 dogs with Cuterebra. I've probably, in my 18, 19 years of being a veterinarian, I've seen, I think, just one case ever of Cuterebra. So not very common. And here are their findings in summary, then we'll go into more detail. They found that most dogs, 80%, weighed less than 10 pounds. Yorkies, Yorkshire Terriers, were overrepresented, making up 40% of cases. Those number of dogs that had systemic inflammatory response syndrome for dogs is 50%, so half of them. Very low for cats, 14% developed SIRS, which is systemic inflammatory response syndrome. So for those who don't know about SIRS, you can literally Google it, and a chart will come up, dogs, cats, and people. And SIRS is a syndrome characterized by, I think, 3 or 4 different parameters: body temperature, white blood cell count, things like that. And if you have a combination of those values, whether they're increased, decreased, or either direction, SIRS is then diagnosed. It's not really a disease per se. It's a secondary sequela to other diseases. And it matters because we find that patients with SIRS typically don't have as good of a prognosis. So having a fever or hypothermia, having a high white blood cell count or low white blood cell count, but these are all in combination. 40% of dogs and 0% of cats had disseminated intravascular coagulation. So disseminated intravascular coagulopathy, or DIC, is similar to SIRS, where it's a syndrome, it's an entity, but it's secondary to a disease. And if you break down those words, disseminated means throughout the body, intravascular is in the vessels, in the blood vessels. Coagulation is forming a clot, like you would if you cut your finger, and then your body stops bleeding by forming a clot. The problem with DIC is that means the body is forming clots anywhere in the body, which carries with it a very high fatality rate. So the body is not supposed to do that. It's supposed to focus coagulation on the areas of hemorrhage, right? But when it goes out of control, it can form clots throughout the body. And there's criteria for that too. There's a blood panel, it's a coagulation panel that looks at things like D-dimers and fibrinogen. There's, like, again, 4 or 5 different blood values you look for, and some derangement in those blood values, low platelets, tells you that this patient may have DIC. Overall, the mortality rate was 17%, but dogs were more likely to die at 30% rather than cats at 4.5%. All the dogs that died were less than 4.5 kilograms, so less than 9 pounds, and they all had either SIRS, DIC, or both. That makes sense. So that's their conclusion in this. And the reason why this is so unique is because classically, Cuterebra was thought of as a local disease with some risk with consistent risk of inflammatory reaction locally, but not really a systemic thing. But this is showing that a fair amount of patients have systemic manifestations. Now, it's not a lot of animals, it's only 42 cases, but it's the start. So let's go into some background. Cuterebra species are large, non-biting, bee-like flies. They are the most common cause of furuncular myiasis in North America. So furuncular means fleas and eggs embedded in skin. And myiasis, M-Y-I-A-S-I-S, means a parasitic infection in human tissue. Cuterebra infection results in the production of a cutaneous warble, or also known as a furuncle, where the larva produces an air pore, like I showed you in that kitten. The larva can sometimes be seen to extrude from this pore. You can literally see the pore kind of inhaling and exhaling. It'll actually pulsate on the patient. It's really gross. Female Cuterebra flies typically lay eggs around the burrows of small mammals. The eggs hatch in response to the mammal's body heat, and then the infective larva attach to the host. These larvae, which are called first instars, INSTARS, enter the host of the eyes, the mouth, nasal cavity, or a wound, and then from there they migrate. Now they can migrate into body cavities or through the muscle layers, and they then settle in a subcutaneous site, so underneath the skin, where a warble is formed. The larva molts to a third instar, at which time it leaves the host to prepare to become a fly. Most infections happen in the summer when flies are most active. Rabbits and rodents are considered typical hosts of Cuterebra. Humans, dogs, cats, atypical hosts. The reason why that's important is because typical hosts usually don't develop signs of infection. But with atypical hosts, because there is aberrant larval migration, they usually get sick from it. Aberrant migration means that the larva has a pre-programmed notion of where it wants to go in the body in a typical host, because it knows that anatomy or physiology or whatever chemicals are driving it. In an atypical host, it gets lost, for lack of a better explanation, and then it goes into some weird places. Weird in terms of what the parasite typically does. Obviously, this is a disease, but and from the perspective of the parasite, it gets confused when it's an atypical host. So Dr. Glass, actually, who I worked with in New Jersey, he's a neurologist. He reported a series of cats with central nervous system infection. There's also another study that found that feline ischemic encephalopathy was caused by Cuterebra. So just real quick, feline means cat, ischemic means a cessation of blood flow, so stopping of the blood flow. Encephalopathy is a generic term of anything that's wrong with the brain. And so these cats form a clot in a vessel or vessels because of some sort of inflammatory reaction. And before MRI, we didn't know why cats got this condition, and then MRI found Cuterebra in their brains. There are other non-central nervous system infection sites in dogs and cats: the eyes, the trachea, nasal cavity, thorax, and skin. Sepsis is as a result of infection with other fly species has been documented more so in tropical and subtropical regions. Systemic signs of Cuterebra in dogs and cats are infrequently reported. SIRS, DIC, multiple organ dysfunction can occur, but appears to be uncommon. And the mortality rate for non-central nervous system infections is considered low. So if you don't have the parasite in your brain, it's obviously a better prognosis. All right. So in this study, one of the Cuterebras were actually looked at by a parasitologist, and they determined it to be either Cuterebra buccata, which is Buccata, or Cuterebra emasculator, Emasculator. The rest of them were not identified. They were identified based on how they looked, but it was an assumption they were Cuterebra species. The mean body weight for dogs was 9 pounds. 80% of dogs weighed less than 10 pounds. The mean age was 55 months for dogs. And then in cats, the mean body weight was about 6 pounds. Mean age was 17.8 months, so much younger than dogs. 59% of cats with domestic short hair, although domestic short hair is the most common cat breed anyway, so no surprise there. The mean number of visits per patient to the hospital was 1.5 for dogs, 1.2 for cats. Mean hospitalization time was longer for dogs than cats, as we just said. 50% of cases occurred in July, 40% in August. 14% of visits involved the initial complaint of Cuterebra infection. So the pet owner saw a defect or a parasite, and that's why they brought them in. Another 14% were seen because of bloody noses. 33% showed respiratory signs like coughing, gagging, and sneezing. Outpatients were 67%, inpatients were 33%. The primary location of Cuterebra larva was in the subcutaneous tissues of neck, flank, and abdomen, which is as expected as well. Some pets had a high neutrophil count, some had a low platelet count, some had protein in the urine. and some had low albumin. And so protein-losing nephropathy is typically a combination of low albumin in the blood and protein in the urine. Protein losing, meaning you're losing protein, and nephropathy is general kidney disease. When we're looking at cats that may have SIRS, 14% look like they fit the criteria for SIRS. All of the cats survived. 50% of dogs had SIRS, and almost half of them died or were euthanized. All dogs that developed SIRS were less than 9 kilograms, so that's about 20 pounds. A portion of dogs had DIC when they were admitted, and all of those dogs weighed less than 4.5 kilograms, which is about 9 pounds. The overall mortality rate with infection was 17%. Of the dogs that died, all of them were less than 10 pounds. All of them had DIC, SIRS, or both. The dog mortality rate was 30%. And for dogs that were less than 10 pounds, the mortality was 38%. So a pretty clear distinction with regard to prognostic factors. Here is to show you the parasite again. That smaller one is a third instar. That bigger one is a second instar. However, because despite the fact that there's a clear difference between the systemic signs of illness with dogs and cats, it wasn't statistically significant, but Yorkies were significantly more higher risk of developing Cuterebra in this study. So 30% of dogs were euthanized or died. Rupture of the larva during extraction by the veterinarian has been suggested to result in anaphylaxis and hypersensitivity reactions. The idea there is that the parasite is considered foreign material. And so if you mess with it, it may release toxins, which is what was thought to cause feline ischemic encephalopathy, with toxins from the worm, and cause a local or systemic allergic reaction. Some thought, but that wasn't shown in this study. They didn't really see evidence of that. Others have thought that when the larvae die, they create a larger inflammatory response because the body reacts to it, but that also is questionable. And so they think in this study that the damage happens during the larval migration. That's when the biggest issues occur, more so than allergic reaction. There also may be different host reactions depending on the life stage of the larva, first versus second versus third instar, but we don't know what the outcome is of that because that wasn't characterized in the study. It's not uncommon for small kittens to have numerous larvae. They mentioned that one kitten here had 5 Cuterebra in it. That's insane. A greater response to antigen antibody complexes and toxins released from the larva appears to be a much more likely explanation for why small dogs seem to have more severe signs than cats. The proposed pathology of protein-losing nephropathy was thought to be deposition of antigen antibody complexes in the kidneys. So just to go over, we did this in another live stream. There are 4 types of hypersensitivity. Type 1 is your typical allergic reaction with mast cells and things like that. Histamine release. Type 2 is this antigen antibody complex deposition into organs. And so this can also happen with joints and other parts of the body, but that's what you see there. Type 2 hypersensitivity. Actually, let me confirm that because maybe that's not right. Type 4 is chronic hypersensitivity, where you have macrophages, and it's a chronic ordeal, meaning at least 14 days. Yeah, type 2 is antibody immune complexes, and then type 3 is what happens with the mother close to birth, where their offspring have a reaction to the blood type from the mom, from crossover of blood in the placenta. Okay, small tangent there. Let's see here. Cuterebra infection has not been reported to cause systemic illness in humans, but sepsis has been reported in people with other parasites. Cats that have central nervous system signs of Cuterebra are lethargic, depressed, they have high or low body temperatures, but these may be symptoms of more systemic disease now that this study has come out. There is an ELISA test. So ELISA is enzyme-linked immunosorbent assay blood test to look at whether or not you have a certain infection. The reason why you'd like to have an ELISA test for Cuterebra is because the only other option is either you have to see the worm, or if it's in the body, you need an MRI to see it. And so, or parasite rather, not worm. So that's why ELISAs are very valuable. He said there is an ELISA for this, but it's not commercially available at this time. Some patients have high white blood cells. Some may have eosinophils that are high or not. Others have normal blood work. So there's no real trend there. Many vets suggest the use of diphenhydramine, which is Benadryl, and dexamethasone, which is a steroid, prior to larval removal. It's because they are afraid that there's a local allergic reaction, and so the Benadryl and steroids will help suppress the local reaction. Others think that if you place lidocaine around the area or in the actual larva, it'll paralyze them, makes it easier to remove the larva without causing a reaction. Some try to actually suffocate the parasite by asphyxiation. They'll do that with liquid paraffin, monkey meat, heavy oil, pork fat, and bacon. That has not been reported in veterinary medicine, but it's interesting to try and suffocate the parasite so you don't have that same reaction. Given the inflammatory reaction that may occur once the larva has died, one would argue that the use of ivermectin is not advised. So ivermectin is anti-parasitic. It obviously became famous in mainstream media during COVID. And most of the time we use ivermectin to kill parasites in animals. However, with this, because you still need to remove the parasite, otherwise you get an allergic, what's thought of as an inflammatory or allergic reaction. We don't use ivermectin for these. There are other fly species that can cause furuncular cutaneous myiasis in North America. They mention here Wolfartia vigil, which is WOHLFAHRTIA space VIGIL. That's another one because they mentioned that in the study they couldn't identify that it was actually Cuterebra except for based on how it looked. So they're admitting that it could have been other parasites too that caused this. So in conclusion, Cuterebra seems to affect dogs more so than cats with severe systemic illness, and Yorkies are much more likely. Pets that develop systemic disease, protein-losing nephropathy, any sort of liver disease, kidney disease, multi-organ dysfunction, SIRS, and DIC are all high risk for dying or being euthanized. And that's the study. That's a cool one. Any questions, let me know. Otherwise, we'll see you guys in the next one. Hope you enjoyed it. Take care. Bye. Bye-bye. 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 Bye-bye.